All right, changing gears. I want to talk a little bit about probably the other hottest topic of the session. It was certainly the most contentious and the most highly monitored debate besides the K-12 funding formula. And that was the effort to find some sort of health care coverage for low-income working Mississippians. I'll say the word, Medicaid expansion. And for years, the response at the Capitol was not just no, but it was entirely dismissed. And you're looking at one of those people who said no repeatedly. They can go back and dig up the clips on Gallo where I was with him, and I was Speaker Gunn's point man on it. And I said no more than anybody. We couldn't afford it. We couldn't do it. We didn't know what the feds would do. We didn't know how long it would be with us. We didn't know what it would look like. We have a huge Medicaid population. We're spending tons of money. All of those things. And it is true. After education, our next largest budget item is Medicaid. We're spending $1 million on it, and then corrections is third at about $500 million. So those are your three big budget items that consume over 60% of your state budget. Is K-12 education, Medicaid, and corrections. Throughout the negotiations on the issue, legislators faced a bunch of challenging conversations and debates. And we didn't always agree on the best pathway. We still don't agree on the best pathway. But here's what a general consensus has formed around, and that's this. The healthcare community, the Mississippi business community, and most Mississippians believe that we need to figure out a way to have some form of healthcare insurance for the low-income population, some access to quality healthcare. And here's the reason. It's not for compassion, and liberal media gets mad when they interview me and I say this. I'm not there because I believe healthcare is a right. I'm not there because I believe this bleeding heart thing that everybody should have the same nice, good health insurance and doctors that Cal has. The reason we're there as Republicans is because of the drain it has on our healthcare system and our economy. You are paying for those people's healthcare now. You're just paying for it in an emergency room setting where it's incredibly expensive. The hospital goes to the uncompensated care realm of it, and it's reflected back into your rates eventually. Now, nobody, especially in this room, would design the healthcare system the way it is in our nation today, and certainly not even in our state. And certainly we have a high population of Medicaid recipients already. But it's not going away. It's been with us now all these years. 40 states are in. We have a Congress that can't agree on an Easter holiday piece of legislation, much less how to repeal a major piece of legislation that has now gotten woven into the fabric of our healthcare system. If we don't figure out a way to skin that cat, and maybe we don't, maybe we won't, maybe the answer for us is we're just going to continue to say no. Here's what I think is going to happen. We're going to continue to be the most unhealthy state. We're going to continue to have a low workforce participation rate. And let me say this too. I don't think that Medicaid coverage, which, newsflash for folks that don't know, it's not a very good health care plan, number one. But I don't think anybody getting Medicaid is going to all of a sudden make them this productive worker. These people are where they are in life for obvious reasons. So I'm not holding them up to be that. What I'm saying is it is a system that is here with us, and I don't think for the foreseeable future anything else is coming down the line. So this is all I would say about that. You're going to continue to see the legislature have honest debate and conversations about the best way to move forward with our healthcare systems. As you continue to see hospitals close, and let me say this too, there are going to be hospitals that close and it has nothing to do with Medicaid. You could do the full, most robust Medicaid expansion plan known to man, and it won't save some of the hospitals that are hurting in Mississippi. It's the same reason we still don't have a movie theater in West Walk. You know, we had one time, and I think now we're down to a liquor store in the bank. But my point is, the most important are the last to go. But my point is, there is a changing landscape in healthcare in the nation and in the world, and certainly even in Mississippi. And so we've got to decide as taxpayers what we're willing to pay for and what we expect. Here's what I would tell you. On the campaign trail last year, my House Republican colleagues for the first time, and maybe it was because of the heated governor's race, but for the first time they started getting the question of, what are you going to do about health care? My hospital, my CEO, who I go to church with at my local church, tells me that our hospital's on the brink of closing, and that if you'd expand Medicaid, that would at least give them a payer system that they don't have now. And don't the feds pay for all of it and all of those things? And let me say this. I fully understand that federal money is taxpayer money. It came out of people's pockets. It's not like it's free money. We all understand that. The problem is this. We pay our federal taxes in Mississippi, and 40 other states are benefiting from it, and they've gone down this road, however uncomfortable it is, and half of them are Republican-red states, I might add. But I will say this, they don't have the large Medicaid population that we already have. So it's not as safe and easy a bet as some have made it to be. Here's the other thing I would tell you about it, and I'm reminded as we continue to kind of kick this can, William Buckley Jr., conservative champion, this quote, "Idealism is fine, but as it approaches reality, the costs start becoming prohibitive." Something to think about. Whatever your position is on health care and access in our state, here's what I would ask you to do. Have an open mind. Talk to your health care professionals in your community. Talk to Mississippi business leaders, the business leaders in your community, and let's see if we can figure out a way. If it's not Medicaid expansion, what is it to get this, to move the needle here and remove the drag that it is on our healthcare systems, our hospitals, and certainly, ultimately, our economy. I am extremely past, a bill that passed, I know I'm long, I'm gonna wind up. A bill that didn't get any press because of Medicaid and K-12 education funding and all the press that they absorbed. We were able to pass a bill with a little fanfare that created a state health exchange. It will move us away from a federal exchange that was created under the Affordable Care Act. It will be set up through our Commissioner of Insurance. It'll give Mississippians better options, save additional state dollars. The premium taxes that are paid will actually be paid to our insurance commissioner and not to the federal government, go back into the plans. It's a good step forward. We had a piece in there that provided tax credits for employers that would put their employees there, especially the low-income ones. That didn't make it all the way through. That'll be a piece next year that we'll work hard on to try to get through. The other thing in the healthcare, certificate of need reform. Douglas touched on this. We are interested in seeing major reform there. We're willing to start in places in our what we call our healthcare deserts, where people say there are no options. We just want to lift all restraints in those places at least and see who might be willing to go there. And then we'll grow it from there and figure it out from there. But if we don't go ahead and start the ball, and sometimes you have to start the clock by passing a bill that just says they all repeal in 10 years or 15 years, that brings people to the table in a real way to start getting some real reform. We will continue to push, and my doctor friends in here are going to hate to hear this, but we're going to continue to push for nurse practitioners, just like we did for optometrists a few years ago, to be able to practice to their full extent of their authority without burdensome oversight that they have to pay for. It doesn't make sense. Other states have moved away from that. We have a doctor shortage now, and I'm all for docs. I have a daughter starting medical school this summer. I'm all for them. But we have a shortage. It's time for us to open that up too. There are places we can make some incremental movements that could have some big effects. The last two things you're going to hear more about next year. The House again attempted this year to restore the ballot initiative, the referendum. And regardless of where you are on that issue, voters, by and large, on the campaign trail, and we polled all this stuff last year all over the state, from Tennessee all the way to the coast. Besides law enforcement, an education piece, this piece polled as much as any. People, whether they want to be involved in a referendum or not, they think something's been taken away from them and they want it restored. So you're going to continue to see the House push. It's going to be narrowly tailored like the ballot initiative we passed in the House this year. But you will continue to see us push that going forward. Another piece of legislation that died a violent death right at the end of session that we felt really good about, the House finally passed a bill that restored voting rights to nonviolent criminals. This was an attempt, we tried to get this in our criminal justice reform piece a few years ago, and some folks in this room helped us on that a bunch, and we wouldn't have got that across the finish line without you. So this was the kind of an unfinished piece of that. These are for nonviolent offenders who've served their sentence, have been released from prison for 5 years, and met every other stipulation of their sentence. They were allowed to get their voting rights back. And it's not just about voting, it's all the other things that come with your suffrage rights. And we say we want these people to be productive citizens. And by the way, 50% of folks who leave the custody of the state of Mississippi are back in the custody of the state of Mississippi within about 20 months. Almost half. Let that sink in for you a little bit. We could send them to State Ole Miss or Southern or Jackson State cheaper than we house them at Parchman. We've got to do a better job We thought this was one more good first step in that direction. You'll see us pass that again and push hard on the Senate to give it a closer look. The last thing I want to talk about, and she's here today, Representative Hurst up here, she pushed hard for a bill that came to be known as the SAFER Act. And we say all the time, when a bill, you clap, that's good. When a bill gets a name like Inspire or SAFER Act, or Clark says if it's simply known by its number, that's a bad sign. But they take on a life of their own, and this bill seemed to this year, and Celeste being a freshman lawmaker, she actually dropped the bill on the House end. Unfortunately for her, it was dropped on the Senate end by the chairman of finance, who really wanted that bill. So anyway, we agreed to take his bill, and there were lots of rocky bumps in the road along the way, as our chairman on the issue couldn't agree on some getting off in the weeds legally. But the end result is this. We were able to pass a bill that as sad as it is to say we had to do it, that defined what a man is and what a woman is in Mississippi, and where they are allowed as far as restrooms and public spaces and those type things. That's not in California. That's not in New York. We had to do it right here in Mississippi. But she persevered, and I heard Cal ask her earlier how that went, and she didn't want to tell him in front of me because she knows I know how heated it got. But at any rate, she fought hard and she stood up for what was right, and she eventually, even with the rule suspension it took, she got her bill and the policy through. And so the sausage making wasn't real pretty on that, but the end result was we were able to get a bill across the finish line that the governor has signed and is now part of the law. We tried to put it in that bill, but we ended up putting it in another bill, and that was a Parents' Bill of Rights. We had in Mississippi a situation come up where parents were denied access to their child's medical records. And I won't go into all the nuances that led to that, but they were actually refused their medical records. And so again, this wasn't in New York or California, this was in Mississippi. We actually had to pass a bill that says it is state law in Mississippi that if the child is under 18, Mike, all those kids he's got, he has a right to every one of them's medical records, and they can't be denied to him. You get the records, not the bill. How about that? But anyway, we were proud to finally get that stuck in a bill and passed as well. So it wasn't all of the Parents' Bill of Rights, but we at least got that piece and kind of moved the needle there a little bit. We're already beginning to prepare for the 25 session. We will have what we're calling a public policy summit early fall, late summer, early fall, and we're going to do a deep dive on the policy that we plan to take up next spring. And I'll give you a preview of those. We plan to do a comprehensive study of Mississippi's entire tax structure and the way, all aspects of the way we fund government. We're going to look very close at continuing to move away from the personal income tax model and moving to a more consumption-based tax model. It's the way you would have designed it if some smart folks in this room had designed a state government system and how to run state government from the beginning. You would have never taxed the work. You would have taxed consumption. We're going to move away from that. The governor has indicated his willingness to partner with us on that. So we're excited about the opportunities as we look at every aspect of how we take your hard-earned dollars and what you spend them on and what we spend them on. We're also going to look at that CON issue as well as the accountability model for our K-12 schools. Those will be our main focus along with Certificate of Need in those public policy summits that we work on this fall. You'll hear some about that. Lastly, let me just say in closing, I'm excited about the upcoming sessions. The challenges are great. The opportunities are there for us to move the ball down the field. I had some say that our ambitions are too much. Y'all bit off too much in first session, and that's why you stalled on some things. I would simply say that's the way you're going to see us do. We may be, the former Governor Haley Barbour, he came in to see us about the ill-fated Jackson Casino project. And he said, he told me, he said, Jason, sometimes, he said, you have a bias for action. He said, sometimes y'all got too much going on and you're moving too fast. Of course, he wanted that Jackson Casino bill moving pretty fast. But at any rate, sometimes we might have moved too fast. We might have bitten off too much. But seriously, we want to work on the things that you wake up thinking about, the things that you think about riding down the road when you're by yourself, the things that you think about when you look at your kids and your grandkids, not while there's plenty of red meat and there's plenty of things for us to pass that are conservative and easy wins, we want to work on some big things and some big gains that not only we can be proud of, but you can be proud that you supported this type of administration. So thank you for your time today. Thank you for the opportunity. I look forward to working with you in the future.